Hi everyone, Alex Wilson here again from Mindful Recovery Services. I'm an accredited mental health social worker and have been working in the mental health field for over 20 years now. My passion is dialectical behavioral therapy, otherwise known as DBT, and that's what this series is all about, the DBT download. And the goal of this series is to introduce people to little nuggets of wisdom from DBT that may be helpful if you're a professional working in different settings, helping people with mental health, or if you're on your own mental health journey or supporting someone on a mental health journey. And what I love about DBT and why I've chosen to make this series is because I think it just has so many practical applications and helpful tips and tricks that can help us all improve our mental health. And so today I'm going to be talking about what DBT is, where it's come from, and why it might be helpful. And basically DBT was developed in the 1990s for the treatment of borderline personality disorder. Now, borderline personality disorder is a diagnosis that's characterized by a range of different things, but often difficulties regulating emotions, an unstable sense of identity, difficulties with relationships, making and maintaining healthy relationships. Self-harm and suicidality are very common with borderline personality disorder, and trauma is also a very common background to BPD. Now, prior to dialectical behavioral therapy coming along, BPD was really considered not treatable. So people with borderline personality disorder statistically have very high rates of suicide, around 10%, and they really didn't respond well to medications, to other types of talk therapy, or other forms of treatment. And so the problem was, how do we help people who are struggling with this when there's really no treatment that seems to work? And so DBT came along and really was the first validated model that showed really good efficacy in trials to people recovering and being able to live a quality life with BPD. So that's how DBT came along. I know there's a lot of letters, BPD, DPD, don't worry about it. So when dialectical behavioral therapy came along, it was seen as this amazing new treatment model for high-risk individuals, people who had previously been considered treatment resistant, and offered a lot of hope. Since the 90s, DBT has been studied extensively. It's one of the most studied forms of psychological therapy, and it's been studied in clinical trials, double randomized control trials, the highest level of scientific rigor, and has been shown to be really effective for lots of different mental health conditions. The core component that DBT seems to work well with is when emotion regulation is tricky. So if you're struggling with emotion regulation, or someone you're working with is struggling with emotion regulation, DBT is likely going to help. So DBT is a very practical therapy. It involves skills, and we come from the assumption that people can't change if they're not taught new skills. That's just common sense. So we have a lot of focus in DBT on skills. We also have a lot of focus in DBT on the therapeutic relationship, and we understand that that needs to be really solid and really safe for people to get better. And that's supported by the evidence that shows that the therapeutic relationship and the quality of the therapeutic relationship is the best predictor of outcomes in therapy, all types of therapy. So we have good relationship, we add some effective skills, and then we hopefully get change. Now, DBT in its full form takes 12 months. It involves 3 key parts, which is a skills training group, individual therapy sessions, and phone support between sessions. I lied. There is a 4th component, which is clinician support. So people working with DBT also have their own support. These components make a full DBT program, and it's that form of the program that's considered the gold standard in DBT, gets the best outcomes. And that's certainly what I've seen in my practice, is that the 12-month program is far superior in outcomes than shorter versions. There are plenty of shorter versions around. We also run a shorter version at our practice, a 12-week version. It's an introduction. And so people can get good value out of it, but, for really big, difficult issues, it's not going to be enough. So if you have done shorter versions of DBT, or if you're teaching shorter versions of DBT and you're not seeing the outcomes you want, that might be why. Because, all of those other components are actually quite important, but they're very resource intensive, and that's why not a lot of places offer them. And so some DBT is better than no DBT. Definitely. And doing groups repeatedly, could help as well. Although the phone coaching and the individual sessions are very important too. So that's sort of an overview of what it is. The other thing to know about DBT is that it's a little bit of East meets West. So what that means is that it blends cognitive behavioral therapy from Western psychology and some of the concepts there, and some new concepts. And it also blends Eastern philosophies and Buddhist psychology. And so DBT, in some ways, does a lot of Western psychological stuff around skills and strategies and change. And it also focuses on acceptance and mindfulness-based concepts. And it's actually the balancing of the two that make DBT really unique, and in my view, that's also what makes DBT really effective, is that we're not going too far one way or the other. We are using the best of Western science, and we're also using the best of Buddhist psychology and Eastern philosophies to help people achieve balance and a sense of peace that everybody is really looking for. Western psychology is very change focused, and sometimes we don't do a great job in Western psychology of acceptance and mindfulness. And in my experience, those things are very, very helpful. So that is your brief overview of DBT. These sessions, these series are designed to be short little nuggets that you can digest really quickly as you're going about your busy week. So please join me next time for the next installment. Thanks. Bye.